Have you been diagnosed with diabetes, pre-diabetes, or PCOS, and you're being told that you need to take metformin? Hi, my name is Dr. Don, and welcome back to the channel. Now, before I dive into the side effects, the indications, contraindications of metformin, I want to talk about a giveaway that I'm going to be doing. Now, every month, I'm going to be giving away a complete dietary program. Now, what I mean by that is what I do with the clients that I work with is I customize a diet based off of how food is interacting with that individual's physiology. Now, over the years, when you have any kind of inflammatory process, you develop food allergies or food sensitivities over time. And so on just about every patient that comes through my office or that I work with online, I always recommend that they get food allergy testing done. Now, this is a $250 test. And so what I'm going to be doing is I'm not only going to be giving away one of those tests, but I'm also going to take the information from that test. I'm going to do a free consult to review the results of that test. And then I'm also going to be sending you a customized dietary plan specifically based off of the results of that food allergy test. Now, there's a few different things that you need to do in order to qualify for this giveaway. Number one, you need to like this video, okay? Number two, you need to subscribe to my channel. The third thing you need to do is you need to click the bell so that you'll be notified every time that I upload a new video. Now, the fourth and final thing that you need to do is you need to just put in a thought-provoking comment or questions in the comment box below. All right. Now, again, I'm going to be giving away a complete dietary program, including food allergy testing. The cost on that food allergy test is $250. And again, there's just four things you need to do. You need to start liking my videos, subscribe to my channel, go ahead and click that bell icon so that every time I post a video, you can go ahead and like that video as well. And then on the videos, as long as I continue to see you putting in thought-provoking questions or comments, then you will remain eligible to win this giveaway. Now, let's dive into information about metformin. All right, now again, welcome back to my channel. And again, this is a video that I shot almost 5 years ago that has nearly 500,000 views. Now, metformin is the most popular drug used for two conditions. Number one, diabetes and prediabetes, but also PCOS, also known as polycystic ovarian syndrome. So there's millions and millions of people being prescribed this medication, and a lot of people want to know, what are the long-term effects? What are the side effects? Is this the right drug for me? And so that's why this video has gotten so much attention over the years. Now, metformin is a classification of drugs called biguanides. Now, this is a medication that it has multiple different effects on your body in order to reduce your hemoglobin A1C, reduce your fasting glucose, and in cases of PCOS, the idea is to reduce the amount of insulin that's being produced in your body and to reduce the testosterone and the amount of androgens that are being stored in your system, therefore leading to things like PCOS. Now, there's a few different ways that this medication works. First and foremost is it decreases how much glucose that your liver drops into your system. Now, let's talk a little bit about that because your body has different mechanisms that controls blood sugar when you're awake or in a non-fasting state. And then it has different mechanisms that controls blood sugar while you're sleeping or in a fasting state. Now, the way that the liver is told what to do as far as dropping sugar into your system is all controlled by the adrenal glands. Now, how many of you diabetics have ever had your adrenal glands tested? That's a good question to ask because the adrenal glands is one organ that has direct effect on controlling blood sugar levels in the body. And so in order for you to completely resolve your diabetic condition or reverse your diabetic condition, your adrenal glands have to be functioning at a good level. Now, what happens is after you go to sleep or after you're fasting for a while, inevitably your blood sugar is going to start to drop. Now, your adrenal glands are monitoring that process all the time. So as soon as your sugar levels get to a certain point, the adrenal glands will release cortisol. that cortisol travels to the liver, and that signals the liver to go through a process called gluconeogenesis, and that's just a fancy term of the liver producing sugar and dropping it into the system so that your organs and your brain can continue to function throughout the nighttime hours or throughout times where you're fasting. All right, and so what a lot of diabetics experience is what's called the dawn effect. And what this is, for example, you go to bed and you check your blood sugars and it's 100, and then you wake up in the morning and it's 150 or even 200. And you're like, well, what is going on? I didn't eat anything all night, but yet my sugars went significantly higher while I was sleeping. That's called the dawn effect. And it's a combination of issues, either the liver or the adrenal glands, or again, a combination of issues between the two, which is much more common. And so in order to find out why you're having the dawn effect, you have to do more in-depth testing than your current physician is doing. You understand that the only thing they're doing to monitor your diabetes is they're testing your fasting glucose, they're testing your hemoglobin A1C, which is a 90-day average of what your blood sugars are doing, and then they're prescribing medications based off of those two markers. And again, in order to completely resolve diabetes or reverse diabetes, there just needs to be more in-depth testing to happen in order to find out why your body is having trouble controlling blood sugar. Now, the second thing that metformin does in order to help the body maintain a decent blood sugar number when you have diabetes is to manipulate how the GI tract or how your gastrointestinal system absorbs glucose. Now, this is mainly done by blocking the absorption of carbohydrates. And so what a lot of doctors do is you're diagnosed with diabetes, you're told to lose weight, exercise, and improve the way you eat. You're told to start metformin, and that's pretty much the extent of the counseling that you get day one. And as you that have been diabetic for a long time, as you know, that's pretty much the extent of the counseling that you get throughout the disease process. Now, if you look at all of the research and all of the literature, metformin is supposed to be used in addition to dietary changes and exercise. But what are you supposed to be eating, right? And that's why I'm doing this giveaway, because there's so many people out there that have tried to eat well, they've tried to eat the right things, they've tried to stay away from the breads and the pastas, and regardless of what you do, you're still getting high blood sugar readings. And so again, diet is a very, very big part of reversing your diabetes, but your diet has to be customized based off of how food interacts with you as an individual, okay? Now, the third way that metformin helps to regulate blood sugars is it increases your sensitivity to insulin. Now, I don't want to go down too far of a rabbit hole on this, but type 2 diabetes, insulin resistance. Type 1 diabetes, insulin dependent, meaning you don't make insulin, so you have to have insulin put into your body so that you can maintain blood sugar. With type 2 diabetes, you're insulin resistant, meaning there's no problem with the production of insulin, and insulin is the hormone that gets sugar from your blood into your cells where it belongs. And so with insulin resistance, as a protective mechanism, your body starts to resist the insulin, therefore desensitizing your cells to the insulin. And so what happens is both the insulin and the glucose remain floating around in the bloodstream and causing significant damage. And so what metformin does is it will increase sensitivity of certain cells. And see, that's how a lot of different diabetic medications work, is because you're not able to get to the sugar into your cells, these medications will drive the sugar out of your blood into different parts of the body. And so metformin, what we've seen with the research, is that it really has a bigger impact on your muscle tissue. And so it's driving more and more sugar out of the blood, but into the muscles. And so the cells of your muscles are being increased in sensitivity. Therefore, the sugar gets to get into the muscles. But again, is it fixing the insulin resistance, right? Is metformin truly, for those of you that have been diagnosed with PCOS, is it truly fixing the insulin problem? Okay, because again, with most women that have developed PCOS, the number one cause of that is obesity in insulin resistance or diabetes. So in order to completely fix the insulin resistance, we have to find out why you have insulin resistance in the first place. But what metformin will do is it will increase the sensitivity of those muscle cells so that you can start to drive the sugar into those muscles. Now, what we've seen and what's pretty typical with most of you that have been put on metformin, how the story goes is you're started on one level. Typically, they'll start you on 500 milligrams of metformin once a day. That will work temporarily. 6, 9, 12 months later, you go back to your doctor. Sure enough, your sugars are going up. They're not happy with your sugars. So what will they do? Well, they will now increase the dosage of that metformin. Why? Well, because your body's adapting to that medication. Your body's becoming less sensitive to the way these medications are manipulating your physiology. Therefore, over time, we typically see more and more medication needed. Eventually, you get to a point to where metformin typically is not enough to do the job, and so they start to add other medications, with many of you getting to the point to where you need insulin therapy in order to have a decent blood sugar number. So, those are the ways that metformin is pretty successful in the short term in order to get your blood sugars under control. Now, what are some of the contraindications to taking metformin? And then we'll talk about some of the side effects, right? Well, what they say is really the only major contraindication to taking metformin is renal issues or kidney issues, right? And the reason for that is because the way your body detoxes this medication out is through the renal pathways or through your kidneys. And so with this medication being used, they are going to monitor your kidney function very closely, and they do that by looking at your BUN, which stands for blood urea nitrogen. They also look at your creatinine levels, and then they'll look at your GFR. The reason why they monitor them so closely is because long-term effects of you taking metformin typically will lead to some kind of kidney issues, kidney disease, kidney failure. Now, if you already have kidney disease, then they won't recommend metformin because of the negative impacts that it does have on your body. So a lot of people are being prescribed metformin and they want to know what the side effects are. How am I going to feel once I start to take these medications? And if you watch people's videos and if you talk to people that are on metformin, you're going to get answers to that question all over the board. We have some people that take metformin and have zero side effects that they experience anyways. And then we have some people that will take it for a couple days and it just makes them feel horrible to the point to where they can't even function. They can't continue to take the medication. But the more common side effects are GI issues. Because of what the medication is doing as far as manipulating how you're absorbing carbohydrates and glucose in the gut, we see a lot of things like diarrhea and nausea, even some vomiting, but we see a lot of GI upset. And that is pretty much the most common symptom or side effect. And I don't really like to use side effect because it is a negative direct effect that these chemicals are having on your body, which every medication does have, right? But GI symptoms is typically what we'll see. Now, in more rare cases, we'll see things like some chest discomfort, headaches, heavy sweating. Sometimes we'll see some low blood sugars. Doesn't happen very often, but we do see some hypoglycemia at times. And then at times we do see some weakness. And a lot of times when your sugars get low, you'll get that sweatiness, you'll get that weakness. We also see some chronic rhinitis, some runny nose with this. And then they say in rare cases, but we do see it, we see what's called lactic acidosis. And this is when lactic acid builds up in the system, and this is a side effect or a direct effect of what this medication is doing to your muscle tissue. So when you work muscles, lactic acid's developed because of what this medication is doing to manipulate your physiology inside the muscles. In rare cases, we will see lactic acid build up, and what that can do is become very, very serious. It will drop the pH of your blood. We can see hypothermia start to set in, and even death with these conditions. And so certainly, if you've had any acidosis in the past, if you've gotten kidney issues, things like this, or if you start to feel really, really tired, if you start to have heavy sweating, things like this going on while you're taking the medication, you certainly want to reach out to your doctor as soon as possible. Now, metformin in 2004 was FDA approved for the treatment of type 2 diabetes. What doctors do nowadays is they write what's called off-label prescriptions, meaning that metformin was FDA approved for type 2 diabetes, but because they've seen improvements with conditions like gestational diabetes and PCOS, they will go ahead and prescribe this medication for those conditions as well. So the first thing I want to talk about is diabetes. Now, with type 2 diabetes, typically an adult onset disease that we're now seeing being developed in even teenagers, type 2 diabetes is a case of insulin resistance. So your body, because of the high insulin levels it's been exposed to for long periods of time, it desensitizes itself to that insulin, therefore becoming insulin resistant. So the insulin's floating through your bloodstream, but it's not able to get that sugar out of your blood and into your cells. Now, your body's brilliant, right? And what it will do anything it can in order to get the blood sugar out of your blood, because the more blood sugar in the blood, the more damage that's going to occur. And so the other thing insulin will do, and this is one reason why we see so much weight gain with diabetes, is it will convert that sugar into fat in order to get it out of your bloodstream. And so if you look up insulin in a medical dictionary, it will tell you that it's a fat storing hormone. That's one of its jobs. And so for those of you that are prescribed insulin and you're told to continue to try to lose weight, you're like a hamster in a wheel doing everything you can to lose weight while you're taking a weight promoting medication. Now, with insulin resistance, there's things that can be done in order to correct the condition, in order to reverse insulin resistance. In order to reverse insulin resistance, number one, you have to find a doctor that's able to test to find out why you have insulin resistance in the first place. The second thing that you need to look for are the triggers that are promoting the inflammatory responses in your body. See, I've worked with diabetics for almost 10 years now, and I can confidently say if I put 100 diabetics in a room, our approach to reversing their diabetes is going to be slightly different in every single case. Well, let me tell you why. There's 4 different organs in the body that has direct control or direct impact on blood sugar control: thyroid, liver, pancreas, and adrenal glands. Now, in more cases than not, these organs and glands are not looked at to see how well they're functioning. Now, the hardest part with treating diabetics is finding out what your triggers are. Now, I talked about the food allergy testing in the beginning of this video. That is something that every single diabetic should have done on them because, again, it's so much more important what foods you've become allergic to or sensitive to versus how many carbs, fats, or proteins that you're consuming. See, if you've developed allergies towards broccoli and chicken, every time you eat steamed broccoli and grilled chicken thinking you're doing a good thing, you're driving more inflammation in your body, and anytime you drive inflammation, you're going to drive blood sugar spikes. So number one, we absolutely need to do some blood sugar, some food allergy testing on you so that we can customize a dietary plan in order to temporarily remove these triggers so your immune response can slow, your inflammatory levels can drop, therefore seeing a massive improvement in your blood sugar control. Second thing is we need to make sure that the GI tract is functioning well. See, with so many diabetics, because of the amount of inflammation that you have in your body, we have a tremendous amount of leaky gut that we've seen developed over the years. The worse the leaky gut is, the more food allergies you're going to be developing, and then you just get stuck in this vicious cycle. See, if we just remove the food allergies and don't address the GI issues, then the food allergies will just change over time. And so we really need to get an in-depth look at your physiology to find out why your body has diabetes in the first place, and then develop a plan in order to get your body back to normal. All right. So again, we've got to look at those 4 organs and glands. We've got to look at what your triggers are. But most importantly, we have to make sure that the treatment you're doing now, is that the best treatment for you? Is that a good long-term approach? See, I'm 38 years old, and I've got 2 kids and a beautiful wife, and I would do anything to make sure that I'm here to see my kids grow up and get married, here to see them have kids, enjoy my what's called so-called golden years, right? And if all I'm willing to do is continue to take medication to slow down the progression of these disease processes, what happens over time is more and more medication comes. So if that's not you, if you want to dive deeper into your physiology, if you want the best chance of completely resolving your diabetic condition or your PCOS condition, then I am the right doctor for you, and my protocols are going to dramatically change your life. See, with PCOS, this is a case of high testosterone and high androgens. Now, yes, the most common cause of this condition is insulin resistance and obesity. That statement was a lot more true 5 and 6 years ago, 7 years ago, in my earlier days of practice than it is today. See, females, your stress hormones and your sex hormones use the same pathways. This is why stress can make a female so much sicker than a male. And what I've seen over the years is it's not just insulin resistance and diabetes that's driving PCOS. I see these very fit, lean females that have developed PCOS over the years. Now, it could be a tremendous amount of stress. It can be underlying inflammatory issues with your gut. It could be adrenal problems. I mean, it goes on and on, all the different things that can cause PCOS that's causing the body to become androgen dominant. But is your doctor looking for the cause? And the answer is no. That's why so many women, when they develop PCOS, they're told that you need to expect to be infertile. See, when your ovaries are full of those cysts, ovulation is hindered, and therefore you're not able to conceive. And so in many cases, the women that I'm able to help get pregnant and help with the infertility, we have to get down to why they're infertile. PCOS is a very, very common cause. But just by taking metformin, does that fix the problem? And that's the question I want to leave you guys with both conditions of diabetes and PCOS. Again, to be eligible for the giveaway every month, 4 different things you need to do. Like this video, subscribe to my channel, hit the bell icon so you can get notifications when I have new videos, and then go ahead and post a thought-provoking comment or question in the comments box below. And then every time I put up a video, just continue to follow those 4 rules, and you will stay in the drawing. And I hope you're the winner, and we'll see you guys soon.